So, triage of the trauma patient, if we start with. So like I say, what we really want to think about is what are our priorities? When this patient comes in and it comes through the door, what do we need to look at and why are we going to need to look at it, and what are we going to act on? Especially if we're in a busy situation, we've got more than one patient, we've got limited time in terms of what we're going to do. Obviously a busy day because the bins are overflowing in the background at that point. So if we think about the human side, if we're talking about triage, if you've been to accident and emergency recently, if you've got children like me and you're always back and forward to casualty, usually the first person you're going to see is a triage nurse. And what they're going to do with the human side, where you've got a big group of people, if you like, that present at once, usually triage is assessing who's most urgent, who can wait. Who's going to wait 4 hours, who's going to wait 8 hours, usually that kind of thing. But have you got an urgent pressing problem that you need to deal with? Have you got breathing problems? Have you got circulation problems? Or is it something more minor? You've fallen off a trampoline, this kind of thing. So certainly usually that's with groups, and same will be with major incidents, earthquakes, natural disasters, war zones, they're going through. Who's not worth spending our time on because they're too far gone? Who's our critical priority that we've got to spend our time on now? Who's the walking wounded? Who's more minor, as it were? With us, it tends to be, you may have 2 or 3 animals are going to turn up at the same time, but usually we want to think about triage in terms of looking at the individual patient. So if this patient has just been hit by a car, it's come in with an obviously dangly broken leg, what are our priorities with this patient? What do we need to look at first with this patient to determine how many problems have we got and which is the most urgent one that we're actually going to treat with things from there. So in a nutshell, the important thing is that we're not going to be distracted by the trivial problems. What we want to do is prioritise our treatment based on seriousness. So if it's one of the major body systems, something that's likely to kill the patient, we want to pick up, we've got a problem there first and tackle that. So if our emergency patient presents and comes through, what do we want to be thinking about? So initially it sounds daft, but regardless, we're talking about trauma patients today, but regardless of the presentation of this patient, obviously the initial thing we want to do is keep it alive to start with. Again, it sounds very daft, but the best way to keep it alive is to stop it dying. And usually you're going to die when one of the big ones, the big organ system stops. If your respiration stops, you stop breathing, you're going to die. When your heart stops, you're going to die. When your brain, CNS stops, you're going to die. So that's usually where our initial focus is going to be on what we would call the major body systems. So respiratory, circulation, brain. So regardless of why this patient's come in, this is another trauma patient, but if this was a septic abdomen, if this was a poisoning case, vomiting, diarrhea, etc., regardless of what started the process, it's when one of these stop that it's going to die. If this patient's in acute kidney injury, what's going to kill it is the potassium gets higher and higher and it stops its heart beating. It's not the kidneys that kill it. So trauma patients, any emergency patient, what we're always going to try and do is our first priority is to look at the major body systems. And if I pick up, I've got a problem with one of those, we're going to deal with it. And once we're happy the patient's stable, then we can look at the whole of the animal. Then we can look at injuries, then we can look at wounds, then we can look at everything else. So important bit, keep the patient alive, focus on our priorities to start with. And once we're happy with these, like I say, we pick up a problem with these, we're going to do something about it and then go on, make certain the patient doesn't deteriorate again, look at the patient as a whole, look elsewhere. So hopefully if everything flows nicely, this is the kind of thing we'd be thinking about in terms of emergency cases. So might be our first port of call, our first communication from the owner is a telephone call. We'll go through this, it might be on that telephone call. We're again trying to gather information to decide, is this a serious problem? Does the patient need to attend? What advice are we going to give at that point? Some instances it may be if we know something's coming down, we can start thinking in terms of preparation. Do we need to get intravenous fluids ready? Is there other stuff we need to get ready? If we know it's a GDV on the way, can we find the stomach tube? Can we find everything else now at this point? Patient's going to present to us and we're rapidly going to physically examine this patient and we're going to look at these major body systems to see, is there a problem? And if we've got a problem with one of them, that's what we're going to treat now.